Speaker, she's got another prior engagement, so she's gonna step in for a little bit, but then she's gonna be leaving. So I'm gonna chair this meeting. I'd like to ask Don Garvin to lead us in the invocation.
Father in heaven, we thank you for this beautiful day. We thank you especially for all the good rain. We ask now that your Holy Spirit will lead us in this meeting, especially with all of our guests, especially the council. In Jesus' name I pray. Amen.
Thank you, Mr. Garvin. Okay, we'll ask the Secretary to roll call.
Meredith Fraley. Meredith Fraley. There. Buell Anglin.
Here.
Bill John Baker.
Here.
Jack Baker.
Here.
Harley Buzzard.
Here.
Julia Coates.
Here.
Bradley Cobb.
Bonnie.
Joe Crittenden.
Here.
Jody Fishinghawk. Janelle Fulbright. Here. Don Garvin. Chuck Hoskin Jr.
Here.
Hannah Glory Jordan.
Present.
Curtis Snell. Chris Cope.
Here.
David Thornton. Kara Cowan Watts.
Honey.
We have a quorum.
Thank you. Our next action of business will be approval of minutes, and I'd entertain a motion for the March 27th regular session.
So moved.
Second.
Got a move and a second. All in favor?
Aye.
Entertain a motion for April 14th subcommittee approval of the minutes.
Motion so moved.
You got a question?
Oh, we have a question?
Yes, Mr. Speaker. I had a question about, on the minutes listed, I was absent. I did come in after the meeting had started, but was just wondering if we have an in-house timeline that if you come in 15 minutes late, you're considered absent or not. So I just wanted to ask you to request that the minutes reflect that I did come in after the meeting started.
Shall you correct that? Consider it done.
Thank you, Mr. Speaker.
Okay. All in favor of that?
Aye.
Okay, next one is reports. I think everybody has their reports in. Has anybody any questions of any of the reports, or you want to ask any questions, or? Councilman Baker?
I'd certainly ask some questions or ask for extra information and what's going on as far as the tax commission is concerned.
Okay, so does anybody have any questions about the Marshal Service?
Yeah, I have one.
Okay.
Sharon, on the 3 districts have been identified and told transition to district structure to be fully implemented by May 1st. You told us what 3 those were last time, but I slept since then.
The district commanders for each
Yeah.
of those areas. James Redcorn, he's the captain. He'd be up in that northern area,
In the north,
above Locust Grove.
Okay.
And Donnie Bowen, this central area from Locust Grove to Stillwell. And then Vincent Smith from the Stillwell, Muskogee area down.
Okay. Thank you.
Any other questions of Sharon? Okay, none. Justice Department, any questions from Ms. Hammonds? No questions? Like, oh, we have a question, okay. Either one.
Trying to the Attorney General's office? Yes.
I've had a constituent call me, and it's on a case that Dana's handling, and there seems to be a whole lot of confusion about how that case needs to be proceeding. And I know he has a plan, but I think he needs to communicate it to those folks, and I think you know who I'm talking about.
Yeah, I do. I thought we had that handled if we done it all.
They're very confused.
Okay.
I had 3 of them called this morning and 2 yesterday, and a judge also called.
That sounds like confusion.
So
All
I
right.
think there is a lot of confusion. I think Dana and I talked about it, and I think he understands how it works, but I don't think he communicated it very clearly to them.
All right, I'll insert myself. It was reset, correct?
Yes.
Okay.
Till sometime in June.
Okay.
And they asked me if I would come, and I didn't want to encroach upon y'all's business, but if you want me to, I'd be glad to be there.
I'm not, I just need to familiarize myself with the file, and I'll make sure that we get everybody
Yeah, because our lady's
up to
not,
speed.
she's not getting any younger, and it's really taking a physical toll on her because she's worried about it.
Okay.
If you'd help us out, I appreciate it.
Sure thing.
Counselor Fishing Hawk?
Can you update us on John?
Yes, we still have all 3 cases pending, Oklahoma County, Cleveland County, and in tribal court. Tribal court last Friday, we had pending against us a motion to dismiss. Becky Johnson argued that successfully, so that case is still alive and they'll be answering. There was also a motion regarding the deposit of $11,000, and the judge decided to keep that $11,000 in that special account until it's determined who that money should go to.
And then I have one more question probably for you and Todd. You see that comment?
While you're looking that up, while I'm here, I neglected to put on our report. We got some good news. We were awarded the grant for the implementation of the Adam Walsh Act. That involves the Marshal Service and Information Systems and my office. Becky Johnson primarily did most of the work on that, so that was good news.
Okay. Like I said, this is probably a question for you and Todd, if you would, Todd. Talk about the motion to reconsider on redistricting that Don and Kara filed.
I haven't even read it, so I really can't.
Well, my question is, what's the appropriate timeline to file?
On a motion to reconsider, normally it would be 30 days unless there are some extenuating circumstances that would need for the court to suspend their rule.
Do they usually suspend it for over a year? I'm curious.
Normally not, but I mean that's we'll see how. I'm sure the Attorney General's office will review it, and we will collectively respond appropriately, I guess, or not.
Or not.
Is that all the questions? Thank you, Ms. Hammond.
Thanks, sir.
Next one is election commission. Any questions? I don't see anybody here from there. So, tax commissions. Anybody have any questions to share? Councilman Baker.
Your report is much different than what you wrote, so if you could just give us an update.
Things have changed today. So
Okay.
the commission had a conference call this morning, and I know most of you know we've been out doing inspections on smoke shops, and if there was yellow stamped cigarettes there, we have seized those cigarettes, made a list of them. The commission made a ruling this morning, though, that if they have their invoices that prove that those were purchased prior to the March 27th, 28th date, whatever the date of that letter was, they got the invoices to prove it, then they can keep that inventory and sell it because it had the appropriate stamp on it at the time, it was legal when they purchased it, and that they should have the ability to recoup their dollars and sell that inventory. So it's now my responsibility to take an inventory of every shop, the yellow stamps in every shop. I'm going to have to be able to maintain, mark those somehow to make sure that, not saying that they would, make sure that nothing is purchased new with the yellow stamps, but then go back and periodically check that to make sure that they are maintaining that and that that inventory is being sold and turned over, and then they eventually will have the blue stamps in the 858 shops. What has been seized will start being returned in the morning. I've already made contact with those shops, so we will get it back to them.
So the shops that you haven't rated yet.
We will still, we didn't rate them, we inspected them.
That's the phone call I got. Right. Okay. The shops that you have visited
Yes, there you go.
and confiscated their goods.
Yes.
We'll get them back.
Yes,
The shops that have not been visited,
we will be.
but you'll confiscate their goods?
No, we will make a list, an inventory list of everything
they
that
got.
has yellow stamps on it.
Gotcha.
Okay? They will sign that list, we'll sign that list. Somehow I'm going to have to mark those cartons. I'll figure out how to do that, and then we will periodically go back and check that inventory to make sure there's not new inventory in there with yellow stamps on it.
Okay, but we won't be
No,
toting any more
we
off.
won't be seizing anymore.
It's easy. All right.
Okay. Yes, ma'am.
I had asked you a couple months ago about the report.
Yes, did you
on-
not?
I've never received it on how much the tobacco sales dropped when the
I'm
Tulsa
sorry.
area's
I thought I
stores went up
sent
to
it.
the higher rate.
I thought I sent it, I'm sorry. I'll get that to you, I promise.
Okay. And
I've been a little busy this week.
Okay, there's one more question. I think Doug may have to help me on this, because it addresses the budget. How will the reduction in the revenue, because you said there's a significant amount,
There's
affect
30
the gen fund or the money? I'm curious.
Tobacco sales are down about 33% compared to what they were last year overall. Now, are you talking about overall sales, or are you talking about something else?
Well, in your report.
Yes, about 33%, I think is what 32.26%.
Can you change that to dollars for me, please?
Not right off the top of my head, I can't, but I can get it to you. Well, 32%, they had 7 million last year, Doug, so if you can do that in your head.
But
that's total tax.
But the net aspect that comes into the gen fund that's available for appropriation is, you already addressed the reduction of revenue in the budget line
Yes, I have.
and pulled it down.
Yes.
You're tracking about, I looked at it day before yesterday, and if memory serves me correctly, I believe you're about 2.5 on the annual net budget now, and close to 6 months into the year, you're about 1.3 on net. So you're tracking pretty close to the budget halfway into the year, but the budget took a significant reduction in Mod 4.
Was it the last one?
It was either 4 or 5.
Right.
We did significantly reduce the revenue projection in a recent mod,
Based on the reduction in the,
based on that. Even prior to the arbitration ruling,
Right.
sales were already down.
One of the things in that budget that really popped out was the surtax revenue,
right, and that's gone now.
but you were already 50% over recognized. I mean, you changed your budget down to $768,000, somewhere right in there, 770 or so.
Right.
But you'd already recognized over $1 million. so
One
far
of
this
that,
year.
should have been, I'll look at that again on that budget, on the surtax.
I think that what the question might hinder on is not necessarily where the budget is, but the reasoning for the reduction in tobacco revenue.
And there's,
Tobacco tax.
one of the major reasons when it first started dropping was the fact that we were no longer doing retail to the creek, because they had done a lot of retail to the creek shops before that, and the creeks established their own wholesaler. And this was addressed several months back, because they're no longer buying from our shops when they were doing retail to retail.
The question you had for me was the impact on the budget.
Yes.
One, which they had already addressed that in the previous couple of months. But the second part of it was when you asked why. And that's what I wasn't able to answer the question yesterday that I recommended that you post today to the tax
And
administrator.
that was the main reason.
Actually explaining, I mean, obviously it's a significant decrease
Yes.
in tax
Yes.
that's flowing all the way into the general fund.
Definitely.
But the reasoning, of course, is, I think, Jody, what
And
I
the
wasn't
main
able to
reason,
answer.
one of the biggest reasons was the creek not being able to sell to them because they established their wholesaler.
Okay. And you don't get me the other?
Yes.
Okay, thank you.
Is that all? Any other questions? Councilor Ford?
Let me see if I got this straight. March the 28th, 27th, it's cigarettes that was bought before that day?
Yes.
Okay, that had the yellow stamp? Todd, I'd like to ask you a question.
Yes, sir.
Is this due to the arbitration ruling?
The retail to
What
retail
this is
stopped, and that's how the yellow stamps were getting into, and I'm sorry, I'm...
No. She's right. Yeah, to answer your question, yes, it is due to the arbitration decision. The arbiters stated that it is improper for retail to retail sales and that the Cherokee Nation was complicit in allowing that.
And by going into arbitration, then we gave away any type of consent to what come out of arbitration, or did that not have to come back to this council?
No, part of what we compacted, part of the tobacco compact is disputes under this would be decided by an independent arbitration board. One chose by the Cherokee Nation, one chose by the state of Oklahoma, and then those picking a third that is, acceptable. Is there an appeal from that arbitration decision? It doesn't call for one in the compact, but that is an avenue, I believe, that the Attorney General's office is exploring as a possible option.
Okay, by this council being seated after that arbitration, you may have some different opinions in this council on that arbitration. Does that make any difference? Or?
In my opinion, it makes no difference. I mean, the compact was approved, and it was approved by the Cherokee Nation government with consent with the tribal council, whatever that tribal council was seated at the time.
I must have misunderstood, because I thought that arbitration, the decision that was supposed to come back to this council.
I can't quote you the arbitration clause, off the top of my head, but that's. We agreed that any disputes would be handled by an arbitration board, and those decisions don't come back to the tribal council, nor did it go back to the state legislature. Whatever that decision is, it is. And is there a possible appeal? Maybe.
Thank you.
Any other questions? Thank you, Sharon.
Thank you.
Self-governance, Vicki? Does anybody have any questions of Vicki?
I just have one update from the report that you have under the brief on future plans and new initiatives, the Muskogee joint venture. We did receive payment. I'm glad to announce it was 16.8 million, a little over 16.8 million. So I just wanted to update you on that. We've been working on that for a long time, and the check is no longer in the mail. So.
Thank you, Vicki. Gaming Commission, Jamie Hummingbird. Anybody have any questions? Jamie's not here. Any questions? None. Codification, Mr. Hembry.
Yes, Becky Johnson did a great yeoman's work yesterday. I was at the meeting for all of 2 minutes before I got a phone call that my daughter was down running in her mile race, so I had to leave. To date, what has been completed is we've gone through all the titles, and we've gone through all the legislation and have assigned the titles to them. We have now gone through all the court decisions and have assigned titles to those court decisions to use as endnotes endnotes as to the actual statutes. The next process, which has already begun, is to take each act and compare it to what is in the book itself, and to make sure that we get all the changes and all the deletions of acts that have been repealed or amended, and then probably within the next 60 days, we should have that process complete and ready to go to a publisher. So thanks greatly to the efforts of Mason Morton, Becky Johnson, Shelley Britton, Kendall Bird, and there's one other. Okay, well, those are the only people that's going to get credit today. Great progress has been made.
Thanks, Todd. GG investigation report. Does anybody have any questions about that?
I'd like to hear one.
You do? Salmon?
There hasn't been a great change from what was reported last month, in that they have continued to move forward. They have continued to get more documents to look at, and so it's moving. And it's still being handled in the federal area.
Does anybody have any questions of Sharon?
I want to tell you thank you for coming out there to Fairfield, answering all the questions and everything.
And I've got to correct one of the things I said there. I thought that was a budget from Stillwell on the animal control.
Yeah.
They got that wrong. That's from Tahlequah, and Stillwell actually just has one officer, so their budget is about half of that or a little less.
Well, I like to go over it. We're still up. Thank you, Sharon.
Okay, that's all. We have just one piece of business here we need to take care of. Julia, can you hear me?
Yes.
On the joint council in October 7th to 11th, do you plan on attending that? We're
I'm
past.
sorry, again?
Go ahead.
She asked you to repeat it.
Oh, the joint council with the Eastern Band and Cherokee Nation on October 7th through the 11th. We're passing around a paper to circle yes or no if you plan on attending. Could you hear that?
Yes, so yes, I plan to attend.
Okay, we're going to circle your name then, okay?
Okay.
Consider you circled. Chris, I think you're the only one left. You're welcome. Okay, moving to old business. Yes.
Mr. Chair, I'd like to make a motion that we move item number 4 in new business before we go into the old business.
Second motion.
Okay, the motion is to move item number 4 into item number 1 of old business, out of new business.
Before old business.
Into new business?
Before the old business.
Before the old business, okay.
People sitting here need to have to listen.
Okay, we have a motion and a second. All in favor of moving item 4?
Aye. Acclamation.
By acclamation. Hearing no against, we'll go ahead and proceed with, under old business, we'll take up item number 4, the legislative act amending Title 68 Tax and Revenue, rescinding the 50-cent Cherokee Nation tax on tobacco products. Who wants to speak on that?
Mr. Chairman, pretty much, I think everybody in this room is well aware of how the arbitration has impacted our smoke shops just really bad. And this is a small attempt to give the 50-cent tax that the tribe is charging to put a moratorium on that until such time as we get a better compact or get something that they can live with. Because folks, whatever money we collect from them, if they go under, it will go to zero. And so I would rather do a moratorium to give them a little bit of relief and give them time to get their feet underneath their sea legs and for us to have an opportunity to maybe get back to something that we can live with. So I'm going to put it in the form of a motion.
Second.
Okay, we got a motion and a second. This is an act, so does anybody have any questions of it? Chris?
Yes, I just got a question on the potential financial impact. What are we estimating here, the reduction in income?
Yeah, going forward, we are calculating we would collect about $56,000 a month on this 50-cent per carton tax, so that's about almost $700,000 a year of income that we would not have if this tax is repealed.
You said 56?
56 per month, approximately $700,000 a year.
They're saying, but we're going to get an additional $4 back.
Right. What Sharon is pointing out is, assuming we move forward, we would get increased revenue from the state on the sharing.
So that would be...
That's an assumption at this point.
That's an assumption. The question was how much revenue is attached to this 50 cents per carton, and that's about $700,000 a year.
Okay, Counselor?
Something that I hope that all council people will keep in mind is that this industry right now is generating 350 plus jobs. Plus it's providing lease benefits to at least 50 additional families. So we have about 400 families that will be impacted by keeping the shops open or closing the shops. So I hope that we'll keep that in our consideration when we vote. I personally will support this for the reason that these 400 families need to be taken care of. One of the things that we emphasize as a council is creating jobs. And this is an industry that has created jobs for our people. And I don't know why we would turn our backs on about 400 families. This is the one thing that I can see that the council has done that has met that initiative, more so even than putting the money from gaming operations into to CMB. Here we have concrete evidence that 400 families are being helped by what we're doing here in this industry. We need to keep it afloat. We don't want them shutting their doors at this time. So I certainly hope all of you all will join me in supporting this act.
Okay, is that all? Councilor Hoskins.
Thank you, Mr. Chairman. And I would just echo that and add that, we don't want to go into compact negotiations with our industry in crisis. That's another reason to support this. And in fact, it's another reason to leave the door open to supporting the industry down the road if they continue to be in crisis, for the reasons that Councilor Bill John Baker and Councilor Jordan mentioned. It's an important industry, important jobs. So I urge passage of it. Thank you, Mr. Chairman.
Any other questions? Dr. Cobb?
Can you tell me an estimate on that? I mean, you may not be able to, but on sharing in state, that did you mention?
Based on current levels, it could be as much as $2 million a year on the state sharing.
My only point to that, I'm not necessarily opposed to this, but I just don't want to get into a Oklahoma Turnpike Authority situation without everybody thinking about it. Are we going to ask for this 50 cents back at some point? So I think that's what I want to make sure that I'm not necessarily opposed to this, but I don't want to set this council up in a situation where we're affecting services in some way. That answered my question, but that if we ask for this 50 cents back, I don't want to put ourselves in a bad position. I'm not necessarily opposed to this, but I did want to bring that out. Thank you.
Councilor Hoskins.
Thank you, Mr. Chairman. And I think it's a good point by Councilor Cobb. As I read the legislation, by operation of law, the tax exemption is eliminated upon the termination or alteration of the current tobacco compact. So it's not an indefinite revocation of the tax. It's fixed. It's fixed to a new compact. We get a new compact, then it seems to me it's automatically triggered that it is renewed. And I didn't write the legislation. That's how I read it. And Councilman Baker may have a different view of it, but I think we're on the same page. Thank you, Mr. Chairman.
Councilor Crusoe.
Yes. Could you kind of elaborate on that thought a little bit?
Yes, it's the tax exemption has what we would call a sunset clause in it, that it would, and Councilperson Hoskins is completely right. When upon the happening of that event, the termination of the compact or the alteration of that compact, this exemption ends, and we will tax in accordance with the new compact or the altered compact.
That answer your question?
Councilman Baker. Yeah, and I didn't write it either. I mean, Todd wrote it after visiting with several of what we could get passed to take care of the immediate crisis. And if we get a really good compact with the state, then we want to collect our 50 cents. If the smoke shops can live with it and thrive and prosper and all. But right now, they can't live with what they're being asked to live with. So until we negotiate another one, and if we can't negotiate a good enough one, then I'm telling you that this will be on the table again. To keep them alive, to keep, as Tina pointed out, to keep the jobs out there. And it's not just the jobs and the owners, but it's the landholders, which we've got a lot of elders out there that this is their only source of income. and is the lease payments that they receive on this piece of royalty or whatever. So, I mean, it's been around a long time, and God willing, it'll be around a long time more, and if we negotiate a good enough compact, then we can go back to collecting our 50 cents, and if we can't, we just can't. But I see it as the only solution of giving them a little bit of breathing room today.
Councilman Harley?
Mr. Baker brought up a good point, and I just have a question on how that works. When we talk about the leaseholders on these smoke shops, how are they getting paid? Are they getting paid by a percentage of what's sold? Do we know that, or are they getting paid by a lease? Can someone answer that?
I don't know that I can.
The question was, we talk about leaseholders here and some of the older people that own those lands that are restricted property. I'm wondering how they're getting paid. Are they getting paid by a percentage of what's being sold, or are they getting just a sum for the lease property?
Different, right?
I'd like to know if that's a fair price for those people.
My understanding is each lease is different, and Realty goes back and evaluates those leases, and some of it is a base amount plus so much per carton that's sold, if I understand correctly. The majority of them is based on their sales. So if sales goes down, then lease payments goes down. I mean, that's the majority, and you guys are the ones that have the leases, and I'm not in Realty, but that's my understanding from the majority of those.
Thank you.
Okay. Councilor Thornton?
I just, when we brought this about and added that 50 cents on the carton, all these shops agreed to that, and they supported that because it's going to help the nation. And they've always been behind the nation, and you know, we need to get behind them. But right now, they're really having a tough time making it. And I've had 2 constituents come to me just this last week and say, hey, I'm going down here to buy in and I'm buying tobacco, but it costs me about the same thing it is in the store. But I can go over here to Salisal and buy it at the smoke shop, and it's $1 or something less. You know, that border rate is putting it on. And any way we can give them any kind of relief is going to help them if they're outside that border rate. So I'm sure we'll support this. Thank you.
We have enough discussion on this. We'll call for the question. Oh.
Yes, sir, and I was just fixing to do that. If you'll allow me, I'd like to call for the question.
The question's been called. This is an act. We'll take a roll call vote on it.
By acclamation.
By acclamation. All in favor?
Aye.
Aye. All noes? Any noes? None? Any none? Passed. Okay, next item is presentation recommendation of the elected officials.
Mr. Chairman, the committee is not ready to report at this time. We have a great committee, but boy, they're busy. You probably know Jennifer is busiest one of all. So we'll make a motion to table this for May Fuels meeting.
Okay. All in favor of tabling this?
Aye.
Councilor Fisher, did you have a question?
No, I was going to ask, I didn't get to ask Vicki Henry any questions, and I was going to ask you towards the end or whenever it's appropriate if I can ask her a question.
Just remind me. Oh, she may be out in the lobby. Okay, next item is act relating to the amendment of Title 19 officers and meetings, adding division of the question. Councilor Baker.
Yes.
Jack Baker.
There's supposed to be some more work done on this that hasn't been done yet, so I move it to table it until next month.
Second.
Okay, we got a motion to move to table it, and got a second. All in favor? Aye. Under new business, this is the Children's Code relating to child protection and background checks. This is Calvin Watts, Rayleigh, Lozer, and Thornton. Who wants to?
I'll go get
You gonna take care of this under new businesses?
Give me just a moment, I apologize.
We'll accept your apology. Yes.
If I could be excused, I'm gonna go back over to the IHS negotiations and stuff. I think you all know it.
You're excused, you only write your separate.
Yeah, I know.
Before I make a motion to approve this, I'd like to ask if anyone else would be added as sponsors. We asked by email, but I think
I don't,
Councilor
I
Jordan?
haven't been getting my email, and this is the one that Indian Child Welfare, I believe, is supporting.
Yes,
If I could, I would like to be added as a sponsor.
I would welcome you. Would anyone else like to be added as a sponsor?
I'd like you to add my name.
Thank you, Councilor Garvin.
I want my name added too.
Excellent.
Does everybody just want to add their name to it?
Yeah.
Okay, just add everybody's name on it.
Perfect. I would like to move to approve at this time.
Second. Okay, we got it approved. Second.
Question?
It's an act, by acclamation.
Yes.
All in favor? Okay. Hearing no no's on it, so. Item number 2, resolution authorizing the waiver of sovereign immunity for SmartNet Healthcare. That's Dr. Cobb.
This is asking for a waiver of sovereign immunity and as such as several business deals. I'll read, the best thing I can probably do is read paragraph A from page 4. The Agency for Healthcare Research and Quality of the U.S. Department of Health and Human Services has provided funds through a contract with contractors to create and conduct a health information network, or SmartNet network, to allow the centralized collection and storage of patient data for access and use by data recipients. This is essentially moving toward a national network of health information so we can provide better care. Patient comes in with chest pains, whatever, they can punch up and pull that patient up and basically find out, are they allergic to, well, actually it's on page 5, I believe, some of the things that will be stored in the network: patient demographic information, diagnosis, pharmacy, allergies and reactions, lab tests and results, history and physical, immunizations, and health risk factors. I would call for question on that.
You moved to.
Second.
Got a second? Any questions? Seeing no questions,
I just want to make sure I understand. This is something that's being done across the country now, is that right?
Correct. And is Rhonda or Sarah here? There you are, you're right there. I brought, I didn't bring, they brought themselves. But they're here to answer any of those kind of questions for you.
And the privacy issues are being addressed?
Yes.
Pertaining to this information? So just not anybody can get this information?
Now, each person that works at the clinic will have access to just the information that they need, like the clerical support will just have information. They can only get demographics and, on up to the provider who will be able to gather all the information. But you'll only be allowed access to the information that specific title needs.
Will this involve individual, it will involve individual patients?
Yes.
Will they be asked to also sign some sort of release that lets them know that they're going to be in this?
I think all the partners are going to provide that information and show that they're participating in the SmartNet network, and then every patient will have the opportunity to opt out.
Okay, that's my concern, that some people do not want their health information given to anyone regardless of what it might be used for, whether it's a good thing or what. And I want those individuals to be able to opt out in the event that they feel quite serious about that. Sure. Okay.
I have Chris and then.
Are there membership dues associated with the membership dues? Was something, we developed this, or it's just, it's open to the public and free to nationwide to any health organization?
Well, right now it's limited to the Tahlequah area, but it's something that's being looked at nationwide.
And it's free of charge and administration?
Is that all? Councilor Thornton?
this hump this time.
Oh, sure.
We don't shoot love. But anyway, by waiving this sovereign immunity, does this nation or this council open up an avenue for lawsuits by those people that you just mentioned that
Well, this was what I was going to ask a second round of questions
may-
about the waiver.
that may fall through the cracks, you know? So there's always somebody falls through the cracks. You don't get signed up, you
Well,
don't drop it.
Anytime we waive our sovereign immunity, we're opening ourselves up to a potential lawsuit. And if that is because we gave out too much information or we gave out somebody's information that opted out of the program, then I suppose that they could sue us for that distribution of the information. And maybe that's a question we need to pose to them. Why do you think you need the waiver?
And that's a good question. I'm Sarah Hill. I'm Assistant Attorney General with the Attorney General's office. The reason we need a waiver is because all of the members are sort of going to be sharing the possibility of liability. So but it's sort of limited, and that's a good thing in this case. It doesn't make us liable for errors. So if we pulled up, let's say someone at Tahlequah City pulled up a chart and it had incorrect information in it, everyone agrees that it's just going to be user beware. Just like anytime you get a chart from a hospital, if there's errors in it, the doctors have to use judgment to determine how they should treat the patient. The liability issue is if we act in a way, or our employees act in a way that's negligent or willful misconduct. So if one of our employees, let's say someone at Tahlequah City, we got some of their information from Tahlequah City, and then our employees posted it on a website and violated that person's information, that patient might sue Tahlequah City. And Tahlequah City could use our waiver to sue us and bring us into that lawsuit because it was our negligence and our willful misconduct that caused that to happen. And so that is something that we're opening ourselves up to in this agreement. But I know health has been they seem to believe this is very important. And it's so important that it's worth taking the financial risk that you take with this type of agreement.
Can I just follow up?
Yes.
Where is the exact wording of the waiver?
It should be in your packet.
I haven't seen it in here yet. Could you
I
kind
think
of
it was a
direct me
handout.
towards the page?
It's not in the SmartNet agreement. It's in the agenda. Was the actual waiver itself.
Has our legal counsel had an opportunity to look at that? And what's his recommendation as far as the wording?
I have had a chance to look at it, because this was sent to my office. You're right. Anytime you waive, you open yourself up to a potential lawsuit. And what that amount's going to be, well, we don't know until we're there. I would defer to the Attorney General's office as to the recommendation if it's a narrow enough waiver of sovereign immunity. I really won't know until a lawsuit's filed to see, to be honest with you, see what type of damages are out there.
Now wait, Todd, I'm not going to let you off the hook that easy.
Okay.
I want your recommendation as to this wording, whether you think this is sufficient or whether it needs to be narrowed.
Well, it's limited between members so that someone outside who's not a party to this cannot use the waiver. Other members of the agreement who we accept and don't object to. So if someone new comes into the agreement in the future, we can object to them and say, no, we don't want you part of this agreement. So it's limited in that sense. It's limited to the types of claims, not punitive, only compensatory damages. No damages after the date of the termination of the agreement.
And compensatory you would describe to this body as actual.
Actual, yes. And it's also excluded in the types. We can only be sued under that for contract. You can't be sued in tort or in any other claim, only to enforce the terms of the contract. So, and it's the most limited one they would accept. The other members would accept. So I would, limit it to nothing if I could to protect us from all liability. But the other partners insisted that at least they be allowed to enforce the agreement against us in court.
Are you saying then, Ms. Hill, that without the waiver, this is a deal breaker as far as our entry into this?
Yes, I believe so. We went over this, Chris Sears and the other members, and I believe this is a deal breaker.
Now, Todd, your recommendation.
I'm satisfied that the waiver is narrow enough. I mean, you are limited only to actual damages, you're not, no one's going to ring the bell for any kind of punitive damages here. But I mean, and you just have to go with every time you waive sovereign immunity, you understand you're taking a step out there, and we're stepping behind our cloak. But with the limitations and the fact that it's limited to members, I think it's sufficient.
And will it only be limited to the members in the co-op right now? Not
Yes.
those that come into it in the future?
Only if they can come in, and if we don't want them in, we have to object. We can object and say, we don't want it to apply to that person, and they will not be part of the waiver. Only people who become a part that we do not object to.
But we have to actually object. We could not write it in here that it's only as for the partners that we have over the next 6 months or whatever, so that we don't have to affirmatively object to those coming in. It's already written in the agreement that this agreement only applies to these people we're dealing with as of right now.
Well, we could, but it limits the usefulness of the agreement because you can't bring it, because the idea is to bring in more people over time. And as new people come on, we bring in Hastings, or we bring in Three Rivers, or we bring in Muskogee Regional to make it more, because the bigger it gets, the more useful it is. So I wanted to be able to add new people as we go along without having a really rigorous process to do that. And so the idea was to make it where they would be accepted, but we would have a window to say, no, we don't want that. We don't want this waiver to apply to that person.
And I see that as something you all need to be aware of, that you have a small defined group right now that you're waiving your right to be sued by. But this group is going to increase without our knowledge, because it will be upon the nation. It'll be the nation's job to object to their entry into this waiver agreement. So you could have 5 now, but you could have 5,000 that could sue you in a year, or 2 years, or 3 years. So you might want to think about that. You've got a defined small group now that can sue you, but it's going to increase, and this body will not have knowledge of it unless you have them come back each and every time to enlighten you as to how this group is increasing.
Todd.
Mr. Chairman, and this is directed to whoever may answer it. How often and at what rate do we project that new members will be coming into this? With the reason being is, could we pass this resolution and as new members join, as a matter of course, bring a resolution waiving it for that individual member that comes in?
I don't know that I can answer that. Maybe.
I don't know that I can answer that.
Well, I mean,
we could certainly rewrite it to do that. I don't know how burdensome it would be.
I would recommend that, and let's see how burdensome it is, because I don't know if we're talking about 1 a year, 20 a year, 20 a month. I don't know. It just depends on how fast and how prolific this thing grows. But I would recommend that we put a clause in there that that upon the application of new members, that this tribal council, in accordance with the Constitution, would waive its sovereign immunity as to that member.
Okay. Councilor Cobb, you're next.
I just wanted to, and I appreciate the concern, and my hope is that anytime something with sovereign immunity, a waiver comes up, that we have these discussions. I think what you need to decide is that we can, depending on your perspective, I know the perspective in the council chambers here in the council house, but perspective is a little different in other parts of the state and other parts of the nation. We are not as big as the United States, and unfortunately or unfortunately, depending on your perspective, that's the way it is. And anytime a business deal comes up, in this case it's a technological business venture, we have the opportunity to either bury our head in the sand and say, wave our flag and say we're a sovereign nation and we're not going to do that and paint ourselves into a corner, or we can realize that if we're going to do business with the United States and entities within the United States, that there are going to be at times that we have to waive sovereign immunity in some aspect. There are going to be times when I don't agree with waiving sovereign immunity. I, as a doctor, will tell you this is important to have some kind of a national, in this case it's not national, but this is the beginnings of it, some kind of network for patients. I can't tell you how many patients come in my office, and I'm going to tell you, because all of y'all know the same thing. When you go into the doctor's office and they ask for history, y'all conveniently leave stuff out, and I have to pull it out of you all the time. And they don't want to tell me what they're allergic to. They don't want to tell me what medications they're on. They don't want to tell me if they've had something in the past. This solves that problem eventually. This is important, and if we're going to be a leader in healthcare in this nation, in this state, this is important. And I believe this is one of those things we need to look at and say, this possibly is worth it. So, thank you.
Councilor Soap?
Yes, Todd, there was some language that was going around as far as what type of suit could be brought against the nation, depending on whether or not we choose to waive our immunity. But could you provide just an example of an issue that somebody could bring against this organization, and then maybe kind of put a dollar value on that?
Yeah,
If you hurt my feelings, that's like $5 or $2. You know what I mean? And I don't see how the issuing information is damaging, but could you?
The type of suits that you would be most apt to have in this situation is, as was stated earlier, one of our employees gets a file that says, "Oh my, I didn't know Mr. X had this," but he apparently got medication for it, and put that on, disseminated this information in some way, either handed it out or put it on the internet or broadcast it some way. Because medical records, you have an expectation of privacy for your medical information. So, and we're dealing here with the transfer of medical information. So that's the type of suit that I would most likely see in this instance, since we're not going to be, liable for errors in the chart itself. So therefore, it is going to be a type of what is my privacy worth, or what type of information was given, and how damaging was it to me in this instance? They're not they're not cheap lawsuits. Depending on the type of information that was disseminated and how widespread that information was given out. But you're only going to be liable for the compensatory or the actual damages for that hurt feeling, okay? We're not going to be held liable for, say, well, Cherokee Nation, we're going to punish you for being so lax and allowing that to happen. So therefore, we're going to give $50,000 for actual damages, but we're going to award them $5 million for punitive damages. So. And those are just figures. I don't know. It really just depends on what type of information and how who it was disclosed to. Exactly.
Councilor Jordan?
One thing you need to keep in mind, though, is let's say information is released that someone has a venereal disease.
Right.
And his wife finds out and divorces him and takes the children. The money amount on that could be extraordinarily high.
Good.
And it not be called punitive damages. Mm-hmm. So you have to keep in mind that what we might call actual damages could be very costly, even though it's not someone physically losing their life. Mm-hmm. But that was not the comment I was going to make. I was going to offer a friendly amendment to Bradley, Councilman Cobb, that would be pass this resolution, but with a amendment prepared by the AG's office that future waivers concerning this agreement will be brought back to the council for consideration.
I'd like your opinion on the ramifications of that first, please.
it's hard for me to say without knowing how broadly they plan to grow this. I think in the short term, that's probably going to be fine. Over the long term, as it grows, I don't know whether all of us will want to continue to do that. And it may be that we just need to change it where instead of it automatically opting in, I don't know. It's hard to say, I guess. It depends on how many people we intend to make a party to this. But for the short term, I don't have a problem with that.
Is that all, Councilor Jordan? Councilor Hoskins?
I just wonder if
Are we going to, is that going to be acceptable? Point of order, I'm sorry.
Also here from the
Let's back up.
I'm sorry.
Okay.
Yeah, before the minutes accepted or not, my recommendation is that we proceed in that fashion until or unless it gets to be burdensome. If we're coming in with 30, 40 resolutions waiving sovereign immunity a month, yeah, that's going to be overly burdensome. If we're coming in with one every 6 months or 2 or 3 a year, it's not burdensome. So Ms. Hill stated that in the short term, it doesn't look like it's going to be a problem, but let's put that language in there, and if at some point in the future it becomes a problem, we can address it.
And is that something that would have to be addressed by the council? So you're going to bring those to the council. And just a quick thought on that. I actually see this at a local level being more burdensome in the short term and then becoming more of a problem nationally in the long term. Is that where you're seeing that the problem is when it becomes a national level?
Yeah, I think because I don't know how big we intend to make this thing, and probably the people who created SmartNet don't know yet either how big it's going to get. And I know the hope is that it gets to be something that's like a nationwide scale. But in the short term, I mean, I don't know. Health.
I do kind of know the intention is to spread it throughout our 14-county area once it gets, I mean, that's kind of the next step.
And even that might get kind of burdensome.
When, and I'm still on your amendment, when do we have the opportunity to opt out of this? At any time?
We can terminate it at any time. I think it's 30 days notice. We have to give them before we can terminate the agreement.
Is your amendment asking for every time a member comes on the network to be brought to this council?
Here's my concern.
Are we looking at a monthly, quarterly, yearly? Are you looking for every time a member comes on the council?
Let's try it and see if it becomes burdensome before we decide whether it will be or not. Here's my problem. We are the keepers of the purse. And anytime we waive sovereign immunity, we have the potential for a lawsuit that impedes our ability to control that purse. And I just don't take waiver of sovereign immunity lightly. I feel like it needs to be a compelling reason when we waive it. And what I see here is that we're waiving it wholesale. And I don't think we need to do that or have to do that at this time. I think we should look at this on a monthly basis and see if it impedes your ability to do this. I'm not against this. I am for this. But I also want to protect the nation and the nation's people and the nation's purse. And we've got to get a handle on waiving the sovereign immunity, because we just had this problem of waiver not too long ago with the landfill and whether we actually did it or didn't do it. Waivers of sovereign immunity need to be brought before this body, and this body needs to clearly understand that's what they're doing each and every time. And so that's why I'm asking that additional paragraph be put in there. Never take the ability to waive the sovereign immunity lightly and never give it away lightly. And only give as much of it as you absolutely have to. That needs to be our rule.
You have no handle on what you anticipate bringing on business point.
I don't. I mean, I don't think. We're still in the infancy stages as part of the problem, I think, and that there was a grant to create this, to try and do this information sharing, and they're just desperately trying to get something to show, or just get it off the ground, even just on a small scale. So I don't think that they really know yet, but it sounds like the 14 county areas, that alone is going to be a tremendous amount. You can see just in Tahlequah, there's a tremendous amount of people involved
Do you
in this.
Do you anticipate any problems putting a paragraph of this sort on this amendment hindering your ability to get on this network?
I don't think it will cause a problem right now. I think I can get the other members. I think they'll be agreeable to it.
Before I decide on the accepting or not, can I yield some time to Councilor Hoskin, please?
Yes.
Thank you, Mr. Chairman.
He's actually up next, so.
Thank you, Mr. Chairman. Thank you, Councilor. I'm hearing two things about the potential amendment. One is that it would be tied to each new member, which I don't know, it could potentially be every week, every day, or once a month, once a quarter. But I also hear something about monthly. So I wonder, do we contemplate that the language would say, monthly? And I think that's not a bad idea, because then you were sort of, for a limited duration of time, waiving your sovereign immunity, you get the opportunity to review. But if we're talking about every member, you could be talking about every week somebody joining and then where are we? Calling special meetings for that? Or?
May I address that?
You care for him to address?
Yes. What I've heard is that we don't know that level yet. Okay. And if calling special meetings to add every member, that's overly burdensome. What I'm saying is, let's see how it grows. We don't know if we're gonna have a new member every quarter or not. Let's see. Let's put that language in there. And anytime, this resolution can be amended or rescinded at any time by future deals. But I would not want to get in a situation in which we waive. We're on a monthly review and where we, when did you actually waive your sovereign immunity or not? Let's do it, black and white, yes or no.
In terms of the black and white, it's going to be tied to new members. That's what
Right.
the language is going to expressly say.
Exactly.
If the amendment,
If he accepts the friendly amendment, or if it passes, if he doesn't, and you guys make it anyway.
And then just finally, I agree with Councilor Jordan. I agree with both of them, actually. I think we live in a world where we have to increasingly waive sovereign immunity if we want to do business with the rest of the world. But it's a constitutional responsibility. And it's one of our most important responsibilities in waiving sovereign immunity. I don't think Councilor Cobb is doing it lightly, but it's worth taking time to talk about the ramifications. And it's definitely something that should not be done lightly and give as little as we have to. Thank you, Mr. Chairman.
Up next, Councilor Buzzard.
I've got my question there.
You got them answered, okay? Councilor Stowe?
As far as the list of partners that are in this project, what percentage or how do we influence the outcome of the project? It sounds like getting off the ground if we opt not to participate at this time and let the other organizations develop the system and then see how it works, and then we apply it as a new member at that time. Is that something that you would perceive to be happening, or is the Cherokee Nation actually the ones responsible for driving this whole project?
I don't think we're the ones responsible for driving the whole project, but I do know that without us, it's a pretty thin information sharing group. I don't know that it would be useful enough to maintain the fund. I can't answer that question, honestly. I do know we're not the only people involved, and I don't know what that would do.
The amendment's on the table.
Well, I have another request from Councilor Jordan.
I would interdelineate within my friendly amendment that it be on a monthly basis, that you report to us on a monthly basis, just so that we know how our group is enlarging and whether we need to take some precautions about the waiver of sovereign immunity that's out there. So that would give us, we'd just be doing it at our monthly meeting.
Coming from a business world, I work on quarters. Would you consider that a quarterly amendment?
A quarter would be fine, as long as we're knowledgeable about the pool and how much it's increasing and how we're spreading out this waiver across this pool of people. Quarter would be fine.
If you move that to a quarterly amendment, I'll accept it.
Okay.
I may have the floor.
Yes. I'm not sure.
I think that part of the purpose of this is to get all of our current members together, and so if we can't, if the council cannot pass this resolution waiving sovereign immunity as to the current members, is the idea to pass this today and waive sovereign immunity as to them, and then just have reports later to see if other people come up? Is that?
Yes.
Okay.
Councilor Critton?
Thank you, Mr. Chairman. That was what I liked to begin with, and somebody suggested that just the ones that were listed or whatever, as far as us waiving sovereign immunity, and someone else came up and said, well, someone might not want to join if we didn't, whatever. So I just think it's too wide open whenever we just start adding more and more to it all the time, and we become subject to who knows who filing a lawsuit against us then. I mean, it scares me a little bit.
Todd?
Thank you.
Mr. Chairman, I just want to kind of make sure that I think I may have got lost in translation here. Is it the intent of the council to pass a resolution waiving sovereign immunity as to the current members, and then take quarterly reports on who has additionally joined SmartNet? Is it the council's intent to automatically waive sovereign immunity on those additional members up until the quarterly report or not?
I don't believe that was addressed, but Councilor
I'm sorry. So you,
no, go right ahead.
that's the way I would understand it. I don't think legally you do it in a way.
Well, I would recommend that you waive sovereign immunity as to your current members in this resolution. And as they come up, you come up with a separate resolution, because we're going to then get into a gray area of when did we grant sovereign immunity and then not, then retract it at a quarterly report. We don't know how fast this is going to grow. Let's waive sovereign immunity as to those current members, and let's see, every month during the health report, they can say, we have a request for a new membership, here's a waiver of sovereign immunity for that new member. We don't know if it's going to be 1 or 20. If it's over 20 or 20 or more, that's going to be burdensome. But we won't know until we get there. And it might be none. So I am of the opinion that you should waive sovereign immunity clearly and distinctly at each time there's a member that requests.
And that brings us back to the monthly, I'm sorry.
Go ahead.
That brings us back to the monthly report so that we could keep ahead of the ball game.
Is it your suggestion that you go to monthly reports?
Yes, it is. And you can do it in the health committee, correct? At your monthly health report, health committee, there can be we have this month we have 3 members who have applied for or that are part of SmartNet, and we are asking for waivers of sovereign immunity on those 3. And then you can,
You'll need to restate your amendment.
I was going to say, you want to restate your motion, then we have some more questions.
The friendly amendment would be that we would add to this resolution a paragraph prepared by the Attorney General's office that would allow us to waive the sovereign immunity as it concerns the group right now that is getting ready to sign this agreement. That would be the initial group, and that future members of this group would be brought to us on a monthly basis with a separate resolution that we waive our sovereign immunity as to them when they become members of the group.
I'll accept that. I call for question.
We have just a couple more. Can I squeeze it? And then we are going to cut it off.
I've got just one real big question in my mind. Most of these partners here are state or federal organizations via IHS or Oklahoma Department of Human Services, Northeastern State University. Are they waiving their sovereign immunity as well in this partnership, or are we the only ones that are wavering anything to deal with these state entities? I guess there's another one on here that's Tahlequah City Hospital that's not a state entity, but what's the importance of that? I don't see why they are requiring us to waive our sovereign immunity just to share information.
Okay. The difference is that Northeastern State University, Tahlequah City Hospital, Northeast Health Group, they are what would, and I'm making a big assumption, but I'm pretty sure I'm right, they are what is called political subdivisions of the state. And there is a title under the Oklahoma State Legislature, under Title 51, that's called the Governmental Tort Claims Act. which there are limited limited waivers of sovereign immunity under these certain circumstances, and you have a big procedure. Mr. Jordan knows what I'm talking about here. So they have, in effect, have already waived their sovereign immunity as long as you follow the procedures under Title 51. We do not have that. We are a sovereign Cherokee or Indian tribe, so therefore we have to have an expressed waiver of that sovereign immunity, and we limit it however we see. Correct.
Councilor Hoskins.
I withdraw, Mr. Chair.
Okay.
That brings up one good question, though. Under the State Torts Claim Act, they limit the judgment that can be taken against them to $175,000. And we're not limiting the amount of judgment that can come against us. It should at least be no more than what they are limiting what can go against them.
And that brings up a point that we have discussed well in the past about the possibility of the Cherokee Nation developing its own governmental tort claims act. But we don't have that to this date. If you want to put a dollar figure as to the amount of limitations, we need to consider that.
Bradley?
Another friendly guy.
I can't see you down here. Would you want to consider a limited amount that we can be sued for, like all the other entities that are in this pool? They have limited their amount by state statute. We could limit our amount by...
I would have to see the amounts that they've limited themselves to.
Todd can probably tell you that. As I recall, it's $175,000.
And that's what I heard, but I want to make sure that all of them are on that page.
I will find out what the limits are under the Tort Claims Act, but I believe it's 175.
Plus, they have to notice within a limited amount of time, which is quite attractive. It doesn't leave you hanging out there forever. They basically got a limitation on time that they can notice you of the claim.
Now, one thing that I don't think we ought to bleed into is try to create a Governmental Tort Claims Act with all the requirements in a resolution like this. I would say that we waive our sovereign immunity up to an amount, let's say $200,000. Just put it out there. That's what we waive our sovereign immunity amount to. But we not get into how procedurally that you got to give us a notice of tort within 1 year of the actual happening or anything like that.
And I would incorporate that thought into a friendly amendment and offer that to you, Brad.
Is anybody currently on that network liable for more than 175?
I don't know who's on the network.
All of our local institutions.
Okay. Well, they would be political subdivisions. I would say that we in this language we limit our sovereign immunity to $200,000.
Do you anticipate any problems with that?
I can't say. I don't. We negotiated. I know that I knew that a waiver was going to be required because of what they wanted. So I don't know if that will be agreeable to the rest of them or not. It's just going to have to be something that I take back to them in the interim.
Do you anticipate anybody on the network being liable for more than $200,000?
Not at this point. I don't. I think everyone is either. I think Todd's correct. They're all at least political subdivisions of the state of Oklahoma. So I don't think so. I would just have to look and see.
I'd accept that amendment. Call for question.
Second.
Okay, call for the question. We opened it up for discussion, and so, Councilor Hoskins, did you have anything?
I withdraw.
Okay. Thank you. Okay, the question's been called. This is a resolution. All in favor?
Aye.
All opposed?
Aye.
We have two, I think. Okay, moving on to item number 3. Thank you, ladies.
Mr. Chair, I'm going to the hell I just I apologize.
Item 3 is a resolution authorizing the negotiation and execution of leases of tribal land and gaming properties. Mr. Carson, you want to address this?
Only so much, Mr. Chairman, is to say that it is the request of the businesses that this resolution be withdrawn to have further study and additions or changes made to it.
Okay.
Move to withdraw.
Second.
Okay. All in favor?
Aye.
The next item, that's done. Okay, any announcements? No announcements. Next meeting is May the 29th at 1 o'clock. Have a motion to adjourn?
So moved. Second.
All in favor?
And you?
I tried, Shelley.
Yes.